It's the best job. 2 days are never the same.
I'm dedicated to meet the needs of the patients every single step of the way.
I love to promote health and well-being, especially for people who've got mental illnesses, and you see the impact it has on their lives.
Our job is about trying to support people to make their lives better. What about that can't be good, really?
I get up in the morning and I look forward to going to work.
I think the vision of the Trust is they want everybody to work towards the same goal, essentially. So it's saying, this is a trust what we believe in and what everybody we employ hopefully believes in, to try and deliver the best care that we can for our service users.
The patients know then that the person that is working with them really wants to help them.
The NHS vision is providing the best care.
The values have some meaning for all of us, whatever our role is, and affect how we deal with each other and deal with patients and colleagues on a day-to-day basis.
It's what our organisation stands for. It's what we want to be able to deliver to our population. We want to instil hope. We want to give the best care. We want to meet the needs of our population. That's our vision.
Those are there as big pillars across a whole organisation, but actually every small team will have the same 4 set of pillars holding it up.
Seeking excellence is about striving to be the best you can be to meet the needs of the patients and service users that use your service, and about engaging your staff in that process from start to finish.
For me, seeking excellence means working to the best of my ability, so working with the patients and delivering the best standard of practice I can.
We can always do better, and no matter if we did something brilliantly, there'll always be something we can do better in the future. So as a manager and as a leader, that's a really important quality to have, because you want your services, you want your teams to think that actually they can always develop, they can always improve. There's always room for a good idea.
I think it's continuing to look at what's evidence-based, continuing to have patients participate in focus groups, continuing to collect our patient satisfaction questionnaires, continuing to review them, audit them, look at what we can do differently. It's all about, engaging the patients, maybe getting more patient stories so that we can hear what patients are saying to us.
My patients are very open and honest in things that they like within my job, the core interventions that I deliver. If they're not happy with them, they will say that we don't enjoy these. So the patients are the best feedback.
Fundamentally, what it does is actually it says that whatever care somebody gets, we're always striving to make it better. We're always striving to make their experience and their outcomes better.
Compassion in action for me is about being there, being kind, treating our service users, other professionals and each other the way that we would want to be treated.
Going that little bit extra for people, it's about putting yourself in someone else's shoes, really trying to experience and feel what they might be feeling.
Thinking about the things that have helped you when you've been through bad times, which seems to be universally having somebody to listen to me, having somebody to understand. And that's what compassion means to me, being able to use those experiences we've all had to help others.
So having that human warmth, that contact, being transparent, being open, listening, helping people out, putting yourself in their shoes.
Getting back to basics, being there, sort of taking the time to listen. It's about taking a holistic approach to care.
Being sincere, being hopeful, instilling hope. Sometimes we have to give really, really difficult news, and how you deliver that can have a huge impact on the person. If you deliver it in a compassionate and humane way, the actual response you'll get will be very different. And for me, that's just not with patients, it's also with our staff. That's how we should be behaving generally.
I think it's easy to draw down a veil and become defensive and less compassionate and empathic over time. So being self-aware of that danger is really, really important, and being aware that we need each other as professionals for kind of peer supervision to be able to talk things through and be compassionate with each other.
Working together means working with everybody. Not only the patients, it's working with your colleagues.
You do have to work as a team. You want the journey for your clients to be a seamless one. So what they get in one area, they're going to get in another area of the trust. and you know, every team will understand how the other team works.
We work together to achieve what we achieve for the benefit of our patients, and we include the patients in that. We ask the patients what they want to achieve through therapy. We set the goals around their needs, around what they want to do, what difference they want to make to their own lives.
Just getting round the table and saying, what can we do to make things better? What could we do to fix this particular problem?
We have an excellent team that deliver the best care, and they're all very unique, individual. We try and bring the best out in everybody so that, you know, we can deliver that.
It's important to hear their views and hear their story to enable us to shape services to meet needs of future patients that come in under similar circumstances.
Respect for everyone means giving what you would give to yourself or one of your family if they were a patient where you work.
Patients are coming in and accessing services for the first time. How does that feel for them? Are they anxious? How would I want to be treated if somebody was answering the phone to me and I was trying to access the service?
When I'm working with a service user, I will think, how would I want to be treated in that situation? Or if it was my family member, how would I want those to be treated?
It means a lot, because you should treat people how you want to be treated yourself, or how you want your families to be treated. And working with older adults, I mean, we've all got we have aging parents and grandparents, and we should respect them and look after them the best we can. You know, they deserve that.